facts are certainly damning, and the testimony from today's first panel illustrates the heartache, the distress, and the consequences of inaction. In my district, the Massachusetts 7th, we have 6 transplant centers, and the majority of my constituents are people of color. We must confront the racial injustices in our organ transplantation system as a matter of life and death, because it quite literally is. So, in the spirit of our former chairman, Elijah Cummings, it is my duty to remain in efficient and effective pursuit of the truth, and so I'll dive right in. Mr. Wadsworth, the American Journal of Public Health published a study finding, quote, the odds that a family of a white patient was approached for donation were nearly twice those for a family of an African American, unquote. Mr. Wadsworth, when a hospital refers a potential donor to an OPO, does the OPO report to anyone whether they approach that potential donor's family about donation and the conversations they have?
They would report to the administrator on call, likely, would oversee the dispatch of that staff member to go have that conversation and guide whether they're ready to have that conversation or not, hopefully in collaboration with the hospital.
Is it true that OPOs likely have that data, which would show how well they engage with communities of color? I'm a firm believer in that which gets measured, gets done. So that data collection and that transparency is so important.
Yeah, absolutely. That data is easily pulled from our EMR.
Well, definitely, I think we need greater transparency to know when OPOs are disregarding potential donors simply because of their race. That will tell the story. So, Ms. Cryer, could you tell us about your personal experience with OPOs failing to approach Black families?
Yes, absolutely. I think the issue that you just raised is the reason why we wanted to have the rules changed to transparent, objective, verifiable, publicly available data. Because before, they could have just said that, there were no patients of color that they approached and given themselves perfect marks for reporting everyone. Moving forward, that can't happen. And that's what we want to keep a spotlight. There will be more objective data and people, OPOs measured based on the entire donor potential, objectively found from hospital records and ICD-10 codes and death certificate CDC data, for example. And so we will be better able to address disparity and inequities in transplant with even better than we have now. And fewer anecdotes and, well, in my case, personal observations over close to a quarter century of working in this community and hearing directly from families who wanted to donate, were not approached, seeing missed calls and missed staff not being on site reported from my OPO colleagues as I visited them around the country. And so we know this to be true. Now we have an opportunity to have more objective, publicly verifiable data for us all know the extent of the problem and to be able to act.
That's right. Thank you. And Mr. Miller, why are Black people being routinely ignored by OPOs when it comes to donating organs?
Congresswoman, I can't speak to the specific case of Ms. Cryer or specifics, but I will tell you is what we're working on. And I would agree with Ms. Cryer. We need to get better. The system needs to get better. And what we've done is convened a diversity, equity, and inclusion task force. And what they're finalizing their recommendations. And part of that is setting standards and setting metrics of how do we look at OPOs and how can we as AOPO and the OPO community get better in our outreach to communities of color.
All right, reclaiming my time. There's really just, there's not an answer because there's no justifiable answer for this discrimination. The San Francisco OPO has made significant progress in including the Black community in the organ donation and transplant process. And the OPO there is led by Janice Whaley. In fact, she's the first Black woman CEO of an OPO who rejected the racist tropes that communities of color wouldn't donate. And in a single year, donation rates went up by 29%, including an increase of 95% among Asian donors and 70% among Black donors and 40% among Latinx donors. Mr. Wadsworth, when OPOs invest the proper resources into ensuring all communities are included in the organ donation process, have they seen results?
Absolutely, yeah.
So some OPOs objected to the CMS rule because it stopped them in my opinion, from using racist metrics to obscure failures in serving communities of color. Let's look at Exhibit B, showing comments from several OPOs. LA's failing OPL, One Legacy. Sure if you can see that at the bottom. It blames the diverse communities in LA for its failure to serve them. The director suggested it was, quote, racially discriminatory, unquote, if expectations were not lowered because they serve a diverse population. Mr. Miller, did you subject these APO members to discipline for that irrational, irresponsible, and biased approach? Yes or no?
Congresswoman, this is the first I'm seeing this.
Okay, well, and what's your reaction? Will they be disciplined for that irrational, irresponsible, and biased response?
I would have to need time to review this document. As I said, this is the first time.
Okay, my time then. Okay. Well, look, in the data that's before you in Exhibit C, in fact, Mr. Miller, we see AOPO supported the efforts of its members to risk adjust for race, which is unacceptable. CMS rejected OPO's racist request to lower expectations for OPOs serving diverse communities, stating that, quote, we are not aware of a biological reason why race as an independent factor would affect the decision to be an organ donor or the number of organs transplanted, unquote. Mr. Miller, will AOPO commit today to stop advocating for racial risk adjustments? Yes or no?
Yes, Congresswoman.
Well, I think today's hearing shows how we have to be intentional in rooting out racist methodologies in our organ procurement process and throughout healthcare. It is exactly why, in partnership with Representative Barbara Lee, I've introduced the Anti-Racism in Public Health Act in order to confront racism in public health head on. It declares racism a public health crisis, because it is, and it helps us to put an end to these disparities like the ones that we've seen play out in our organ transplantation system. Thank you, and I yield.
Thank you.